My name is Shraddha Kalekar, and I am here to give a presentation on the topic exploration of serum multi-biomarker model in colorectal cancer screening. So, I am from Sierra Institute, Lonavala. So, firstly, I want to tell you what are biomarkers and why they are used in cancer screening. So biomarkers are wide variety of endogenous molecules, including DNA, transcription factors, cell surface receptor, metabolites, and secreted proteins. So biomakers refers to the substance or the process that is indicated of the presence of cancer in the body. They indicate the presence of cells of cancer in the body. So we use biomarkers to detect the cancer. So my manuscript was written by Ruhanu Zhu, who is an Chinese scientist, Department of Clinical Laboratory, hospital affiliated to Shanghai Jiaotong University Schools of Medicine, China. So they majorly focused on the topics clinical relevance, biomakers panel, diagnostic accuracy, and clinical trials. So clinical relevance. It means the study focuses on the clinical relevance of serum multibiomarkers models in colorectal cancer screening, aiming to improve early detection and patient outcome. So these are some of the methods we use to detect the rectal cancers or at the early stage. Second is the diagnostic accuracy. The research examines the diagnostic accuracy of the serum multibiomarkers model, assessing their sensitivity, specificity, and predictivity value. Biomarker panel. In this, we study and investigate a specific panel of biomarkers. So it becomes easier for the detection of cancer cells in the body, analyzing their individual and combined contribution to cancer detection. So biomarker panels are mostly used and are popularly known. Clinical trials basically we used for the medicines and surgery purpose also. The research involves a clinical trial to evaluate the performance of the serum multibiomarkers model in the real world setting. So my manuscript was majorly focused on the topic statistical analysis, means in the last few years how many cases were detected by rectal cancers and what are the techniques by which we can overcome this and we can easily diagnose the early detection phase of this cancer, and what are the new techniques which are evolved now for the detection of the cancer and also the treatment of the cancer. So firstly we will study about the statistic analysis. International agencies of for research on cancer of the Health World Organization, there were 1.93 million new cases of colorectal cancers worldwide in 2020. So as we have passed the lockdown era, by then oral rectal cancer patients were emerging widely, with approximately 930 deaths. So next is colonoscopy. Being an invasive procedure, carries inherent risk like bleeding and perforation. The necessity of meticulous bowel preparation can contribute to an unfavorable patient experience, diminishing willingness to adhere to regular follows up. So colonoscopy also, it is an invasive procedure which carries the inherent risk of bleeding and perforation. So emerging techniques, serum multibiomarkers models are developed and are widely used for detection of early cancer, which offers a potential solutions also, providing a non-invasive and cost-effective approach to colorectal scanner screening. So majorly the biggest advantage is it is cost-effective and are widely preferred, and mostly every hospital are taking available for this techniques. So methodology of evaluating the performance of the serum multi biomakers model. The study employed a rigorous methodology to evaluate the performance of the serum multi biomaker models. So there are various techniques by which we can use the biomaker model to evaluate some of the cancer phases. So firstly is sample pre-processing. So sample pre-processing, it is the few steps by which we can identify the phases. 4 millimeters of fasting whole blood samples were collected using red top serum separator tube. These samples were centrifuged at 2658 into gram for 10 minutes to separate the serum, with lipemic samples excluded. The serum was then stored at minus 80 degrees Celsius until analysis to avoid repeated freeze thaw cycles. So this is one of the process we use for the sample pre-processing. Means before the sample use, we store the samples at minus 80 degrees Celsius to have an effective effect. Detection of tumor makers. CEA, CA125, CA199, and CA724 were assayed using the COBAS E810 automatic analyzer. So CAE, these are the tumor cells which are detected by an automatic analyzer with corresponding reagent kits. CA50 and CA242 were analyzed using the Malgumi 2000 automatic analyzer. So the next two enzymes, CA50 and CA248, were analyzed by Malgumi 2000 automatic analyzers. So we used two analyzers in the detection of tumor makers. One is the COBAS and the next is the Maglumi. These are the methods used for the detection of all the biomarkers. Data collection. In the data collection, we collect the blood samples from all participants which are suffering from the colorectal cancer, and serum biomarker were analyzed using state of the art of the technique. So here is one of the process which is presented in a flowchart manner. So study participants. So the number of participants were taken 91 colorectal cancers and 120 healthy patients. So the detection of 30 indicators, 9 lipids, 15 bile acids, and 6 tumor makers. So in the addition of Mann-Whitney U test, 22 indicators, 9 lipids, and 11 bile acids, and 2 tumor makers. In the presence of AUC, 11 indicators, 3 lipid and bile acids, and 1 tumor markers. So we get training sets and internal validation. Training sets is 80% and internal validation is 20%. In training sets, we get 72 colorectal cancers and 98 healthy cancers. So 19 in that stepwise binary logistic regeneration, and in the internal validation, it is the validating the screening model. Together we get 4 indicators: APOA1, APOA2, ICA-CEA develops the screening models. So we get sensitivity 94.44%, specificity 97.92%. In the other, we get 94.74%, specificity 91.67%. External validation. So in this external validation, we have 22 cancer patient and 22 healthy. So validating the screening model, we get sensitivity 90% and specificity 90%. So we get more specificity and sensitivity in the training sets, which is 94 and 97%. So overview of serum multi biomakers model cancer detection. Serum multi-biomarkers models are based on the principle that cancer cells release specific protein and other molecules into the bloodstream, which is of course not healthy for a normal human being. So, biomarker discovery. Advanced technology are used to identify and validate potential biomarkers for cancer detection. All biomarkers are not used for the cancer treatment. Specific biomarkers after the clinical trials and many more trials, it is used for detection of cancer. So, other is model development. Statistical and machine learning algorithms are employed to develop predictive models based on biomarker profile. So, model development also contribute to uh, for the detection of cancer. Clinical validation, the models are rigorously validated in clinical trials to ensure accuracy and reliability. So accuracy is more important in when we use biomarkers. More accurate biomarkers gives the more accurate results. So next is development and validation of the colorectal cancer screening model. So we see here a graph. A graph indicates the various enzymes and by which the graph rises as per their specificity and sensitivity. The performance of model Y was accessed using the ROC curve as a new variable. The AUC for diagnosing CRC was 0.995 as illustrated in figure. The model exhibited a sensitivity of 94.44%, a specificity of 97.92%, and an accuracy rate of 96.43%. So here we see there are 1, 2, 3, 4, 5. It is actually four substance present here, and by which the graph rises above and above. The last one, which is in purple colored, it is a CEA. The second last is LCA. Third last is APOA2, and the first one is APOA1. So the x-axis and y-axis are respectively specificity and sensitivity. So by which we can evaluate the development of the specific biomarkers by which it rises above and above. New techniques and instruments, as we have seen that emerging techniques are very crucial and necessary for testing oral rectal cancers because the demand is high. This research utilizes cutting edge techniques and instruments for biomarker analysis, leading to more precise and reliable results. So the first one comes is mass spectrometer. So mass spectrometry enables high sensitivity detection of specific biomarkers in serum sample. So if we add a biomarker and later on another one comes and they want to make some modification, so they should know what biomarker have been used first. So mass spectrometry is the great advantage which are used to detect which biomarker is present in a particular serum. Second is ELISA. ELISA assays are widely used for quantifying specific protein, providing accurate biomarkers measurement. So, in what amount the biomarker is present in the serum is detected by the ELISA technique. The next is molecular diagnostics. Molecular diagnostic technique provide detailed information about genetic and epigenetic alteration related to cancer development. So this provide a genetic and epigenetic alteration related to the cancer development. Algorithms. Algorithms are used to analyze large data sets and identify complex pattern associated with colorectal cancer. Key finding from the study of the model sensitivity and specificity. The study demonstrates that the serum multi-biomarkers model exhibit high sensitivity and specificity for the colorectal cancer detection. The first is sensitivity, the second is specificity, and third is overall performance. So majorly we focus on sensitivity and specificity. The sensitivity, the model successfully identify a significant proportion of patients with colorectal cancer, minimizing false negatives. So it identifies at what proportion the patient is affected by the cancer, minimizing the false and negative feedbacks and giving the original copies. Specificity, the model accurately distinguished between cancer patient and healthy individual, reducing false positivity. Overall performance, the high model sensitivity and specificity indicates its potential as a valuable tool for colorectal cancer screening. Results and conclusion. The result of the study provides strong evidence for the feasibility and effectiveness of the serum multi-biomarkers model in colorectal cancer screening. So, 3 point is more important, which is early detection, improved outcomes, and future potential. Early detection is always a necessary criteria to avoid the further processes and easy to cure a patient. The model can potentially detect colorectal cancer at early stage when treatment is most effective. So first stage of the cancer is more easy to be cured and detection. After that, we have to focus majorly to kill the cancer. Improved outcomes. Early detection through this model can lead to better patient outcome, including increased survival rates and reduced disease progression. Future potential. The model holds promise for future research and development, potentially revolutionizing colorectal cancer screening practices. Limitations and future research. While promising, the study also identified limitations that warrant future investigation. Larger studies. Further research is needed to validate the model in large number and more diverse population to confirm its generalizability. Longitudinal study are required to evaluate the model's long-term performance and its impact on patient outcome. Biomarkers panel optimization. Ongoing research should focus on optimizing the biomarker panel and improving model accuracy. So this was the whole presentation about the biomarkers used for the cancer and for the treatment, and also the future models which are going to be used for the treatment of colorectal cancers. Thank you.